Okay, we're here today. This patient or client has lateral epicondylitis, which is an inflammation of her tendons. It is a tendinosis, and what we want to do is bring blood to that area. And so first of all, for a layperson that's going to be using this, we're going to skip all the evaluations and such, just because we're going to skip through some of that. But a layperson, we just want to go in here and feel if there's any tightness. And she's got some tightness and some soreness right here. And so we're going to treat this area. And most of the time, you're going to find the area to be treated not in the muscle belly itself, but right where we call the tendinous muscular junction. And so it's right here on her. And on the medial side, she may have some discomfort. Yeah, she has a little bit right in there. And so we're going to treat that area. This is the mild cream that we're going to use. We're going to just take it and we're going to put a little dab, about the size of a dime on there. We always put it on the applicator, because if we put it on our hands, the patient's hands or the client's hands or my hands, I touch my eye or anything like that, it's going to get cross-contaminated. I also use it for my athletes, the applicator, because you put it on your hands, you touch a basketball or a bat, you're going to cross-contaminate, and you touch your eye, and maybe your teammate will get it. So this is one of the reasons why we came up with the applicator, but one of them. The other one is that we're going to break up that hypotic area as we scrape it. Okay? So we're going to first, we have identified where her discomfort is and her pain. So now we're just going to lay it on here, and we're just going to go back and forth, and we're going to be listening for some, almost like a Rice Krispie sound or a tightness. And then we always get feedback from the patient or the client. You feel a little sore there, right? Yep. And then you know you're in the right spot. You just hold it there for a little bit, and you don't have to go very aggressive. Now, you may get some redness. We call that an axon flare. That's when there's getting blood to the area. And what we found is the applicator actually produces a little bit of a heat, which helps drive that medication or the pain cream into the tissue. So the medication or the topical cream gets pushed in, and you can feel that. I'm going to work on through here and always get feedback. How you doing?
Yeah, I'm good.
Okay. And so I always like to go, before I finish, I always go distal to proximal. So we're pushing all that hypotic waste material back up to a heart and liver. And we're just going to do a little bit over here. And you can feel that, right? And then different down here, same pressure, and a little bit painful there, yeah. And so you just go nice and easy. I like is less is more. You don't have to go, and you don't have to, really be aggressive on the skin. Just nice and easy. You feeling that? Mm-hmm. Okay. And what I do then is just bring your wrist up for me, and then now you're just shortening that muscle a little bit. Now bring it down. Now you lengthen that just a little bit, and that's about it. And then before I finish, a couple little strokes, just to the proximal. And you should only spend about 1 minute to 2 minutes in an area. And that's it for lateral epicondylitis. This is a very light treatment, but for a layperson, this is exactly what I want. How's that feel?
Feels really good.
Okay, now I want you to, now what I like about it is this product you get to take home with you. So I would offer the applicator to the patient or the client. They can buy any of the cream, and then we just teach them how to do it. So I'm going to have you take your left arm, and then I'm just going to have you work on that area, and I'm just going to walk her through it. So remember, just start off, find that area that's sore, yeah. Just back and forth. And then you bring it over to the top. That's it. How's that feel? You okay?
Good, yeah. Really
okay,
good.
and then when you stop, you always go, we'll push it up this way.
Push it back.
Yeah, and then that's it. So that's how we would do somebody that has like a lateral epicondylitis or elbow pain. And you can see she's got a little bit of axon flare, which is that redness. Now, if we went very hard and aggressive, you would get what's called petechia. And petechia is just the breaking or hemorrhage of the small little blood vessels. And that's okay because you want to bring blood to that area. And I'll see, yeah, she's going to get a little bit here. You feel that, huh?
Yep.
So this is if I got a little more aggressive. And I would only do this if I was a practitioner. And yeah. And she got a little bit petechia. And that's, again, that's normal. But she's pretty healthy, so that looks pretty good.